let's talk about this medication called methylprednisolone, aka, and so much easier to say, Solumedrol. Solumedrol falls under the drug class of corticosteroids. Why would we, as EMS providers, administer a medication like Solumedrol out in the field? For a few reasons. In certain cases of allergic reactions, asthma attacks, and bronchospasms. Solumedrol works by reducing the immune response of the body, and it does it by blocking inflammatory mediators like prostaglandins. And although Solumedrol is not a smooth muscle relaxer, it's not classified as a smooth muscle relaxer, it can have smooth muscle relaxant like qualities because there's less swelling, there's less inflammatory response. Contraindications of Solumedrol can include premature infants, septic patients, patients that have fungal infections, really any patient population that is already severely immunocompromised. Before we get into the next one, I just want to make it known you have to follow your local protocol, stay within your scope of practice. So a typical dose of Solumedrol is 2 milligrams per kilogram, and that can be given IV, IO, IM, and that's for both the adult and pediatric population. Some protocols you read might just have for the adult population just a standard dose of 125 milligrams, so the whole vial. And it should be noted that Solumedrol is a medication that requires reconstitution like glucagon. So it is a powder form. This liquid right here will go in, you'll mix it up, and then you can draw it out and administer it in whichever route is applicable. Common adverse reactions you may see after the administration of Solumedrol are hyperglycemia, nausea and vomiting, headache, and even a little bit of fluid retention. Drug interactions for this medication. Solumedrol can antagonize insulin and can cause the blood sugar to go up. So that's just a consideration to keep in mind whenever you have a diabetic patient or a patient that already has issues with their blood sugar. And a side note about this medication, unless you have an extremely long transport time, the benefits of this medication or the desired effects aren't going to typically be witnessed in the 911 EMS setting. It usually takes some time to kick in, is what I'm trying to say. So don't put off other life-saving medications or procedures to administer Solumedrol. So for example, if you have a patient that is having an anaphylactic reaction, we aren't going to put off epi for Solumedrol. Make sense?